morning.
Hi, my name is Angie. I'm going to be your nurse taking care of you today. I've got orders here that I am going to do some suctioning of your trach. And also, while I'm in here, I'm going to go ahead and change out that inner cannula as well. And clean up your dressing and everything. So first things first, let me get your name and date of birth. I've got Emily Grace, yeah, and 2/22/67. All right, yep, that matches my bracelet. I see here you do have an allergy bracelet. You're allergic to compazine and penicillin, is that correct? No latex allergies or anything like that? Okay, great. All right, so like I said, just gonna do some suctioning. They've been doing suctioning on you. Okay, so yep, just a little tube that we're gonna go down into that trach. Hopefully won't cause too much discomfort, but we'll be quick with that. And then once we've got you all suctioned out, then we'll do the dressing change and change out that cannula. So let me raise your bed up here. I'm going to go ahead and also, I've got oxygen on you. It's at 2 liters. I might just turn it up to 4 for now, just to hyperoxygenate you just a little bit as we get started, but then I'll turn that back down. And I'm just going to put this to drape over your chest. I've also got suction that is turned on. I've got it set at about 120 here. And then we will get everything set up here. Bring this up to waist level. If I bring you up just a touch more too. This isn't completely necessary to put this drape over the table, but I'm going to. Before I do suction you, I do want to put you on. I'm just going to kind of keep an eye on your oxygen levels as we're doing this. So I'm going to put this pulse ox on you. And I'm also going to take a good listen. I want to listen to you before and after I suction. So just take a quick listen to your lungs here. All right, so I'm going to open my kit. I like to throw that in the trash, that way it doesn't fall back in my field. And I want to get my gloves out. Careful to not let that hit my catheter. Sometimes that little box that's in there to pour your sterile solution in is on top of that catheter. If that's the case, if you're careful, you can pull that out first and set it up and then prep your saline. Since it's underneath, I am going to go ahead and loosen the cap just to make this easier on myself, knowing that I'm going to have to kind of pour one-handed into that. So I can either loosen, take it off, whatever the case may be. So I'm going to go ahead and use the gloves that are in the kit, but I also brought my own just in case. I'm not a huge fan of the gloves that come in the kit, but always good to have an extra set. So I don't have any sharp jewelry on. If I did, I would remove that before putting on my gloves. Since I put down that drape, I don't necessarily need that drape. It's a personal preference. I'm just gonna set it here. I don't really need it. So I wanna be careful. Now I can, since this inside of that field is still sterile, I'm gonna use that to set my catheter down just to make this a little bit easier to get my box out. Did a good job of putting this box down in this tray to make it very difficult to get out. Set up my little box here. And so I had to think about, I want this to remain my sterile hand. So since I want this to remain my sterile hand, I'm going to walk around, not turning my back on my field, because once I touch my solution, this hand is no longer sterile. So I'm going to pour my solution here. Set that back down. So since I am only doing tracheal suctioning, if I noticed that they needed like some nasotracheal suctioning or something like that, I would get some water-based lubricant, put it down inside my package so I could lubricate the end of this with a water-based lubricant. But since I'm just doing tracheal suctioning, I could just use the solution in here, this water, as my lubricant for the trach. So since I'm gonna, again, this is my non-sterile hand, I'm going to connect my suction here. And then I'm just going to test it out, and this is what's kind of lubricating that in there. Okay. So at this point, I want to pull back my oxygen. All right, Miss Grace. So I'm going to do this up to 3 passes. I'm going to oxygenate in between each pass. Again, keeping an eye on my pulse ox as I do this. So I'm going to insert. Do not apply suction as I'm inserting until I meet a little bit of resistance, or she might start to cough a little bit. And then in a swirling motion, I'm going to pull back, suctioning as I go. Replace this, hyperoxygenate in between passes. Give her a little bit of time in between each one. I don't want my suction to be applied for more than 15 seconds. So again, I'm going to go for my second pass here, down until I meet resistance. Allow her to recover a little bit, and then do my final pass here. If I did notice that she needed nasotracheal suctioning and like oral or nasal suctioning, I would do that after my trach suctioning, just because the mucosa in the nose and the mouth is a lot dirtier than that would be in the trach. So it's better to go trach first, then mouth, nose versus the other way around. And again, if I needed to, I could also use a water-based lubricant before inserting into her nares. So at this point in time, I'm done with my suctioning, so I can remove my cannula there, and I can put this yank bar back on here. And so I'm going to clean up. I'm going to go ahead and just leave that same drape, since I'm going to be moving into my tray. I'm going to clean up my mess here. I'm going to go ahead and choose to reassess lung sounds now. All right, so now let me grab my trach care supplies. So moving into my trach care here, first things first, I want to get some just regular clean gloves. And I'm going to take out that old dressing at this point in time. Work here. We can pull that down, at least get a little bit of blow by if needed. So pull out the old dressing. I want to keep my ties in place there. All right, so I'm going to open this away from me. I will say personally, I find the gloves that are supplied in the trach kit very difficult to manipulate because it's hard to see with them being clear. Okay. So I'm going to get my supplies out here. It does come with a cut. I like to separate these out, a few dry, a few wet. If you notice that your trach was really kind of dirty, then you can bring extras if needed. Grab my trach tie there. So at this point, again, I want to pour my solution, and when I do that, that hand is going to then become non-sterile. There's a couple different ways. You know, sometimes some like to just pour a little bit in there, then you can put some wet gauze down in there if you needed to. Okay. So what I want to do is grab my inner cannula here with my non-sterile hand. And put it in the tray. So what I want to do is hold this. I can kind of put it down in my basin, clean it off, use my brush to clean inside. I want to make sure, you know, when I'm doing this, I'm careful not to touch a part with my sterile glove. So clean inside, clean the outside, any areas that need to be cleaned. I can't set this back on my field, so I can either set it down in here, or if I know I'm done with it, just throw it away. So I'm just going to throw it away, and then I can use my pipe cleaners to dry it out. Making sure to get that excess moisture. You don't want it to have a lot of moisture on it. So, you know, if it was pretty saturated, then you would want to just wait until it is dry. So, I'm going to replace that. So now that I've done that, I'm going to clean around, and I could either use that if that was really yucky. I personally would grab a little bit more solution in an area so it's cleaner. And then I want to clean, making sure I can clean up underneath that with my Q-tips. Do it again. Cleaning up around that site. If I also wanted to get one of these wet, and then clean the faceplate if needed. And then once I've done that, I would take a dry dressing or a dry 2x2 and dry that area off on that faceplate. So really at this point, I mean, I'm still trying to maintain keeping it as clean as possible, but I'm technically working outside now in the area that is not sterile, so I'm going to place my split gauze here. See some kits that come with little tweezers, which are great. Makes it a lot easier to get that gauze up underneath there. And then replace my ties. Tweezers also come in really handy for this as well. So I'm going to leave the other one tied until I have the new one in place. be able to easily fit 2 fingers up underneath there. I don't need that too tight. And then now I can replace or remove the old. So this time I had turned her oxygen up to 4. I can turn that back down to her normal at 2 if that's what was ordered. Put my trach collar back on securely. So she's getting the oxygen she needs. Clean up my supplies. Throw all this away. And take my pull socks off here. Lower you down here, Miss Grace. Give you your pillow back. Make sure she's got her call light. Bed is in a low lock position. Side rails are up. My mess has been picked up. With me. All right, now Miss Grace, so I mean you've had this trach for a while, but just give us a call if you're having any difficulty breathing with your suctioning. I do have orders that it can be done as needed as well, so it's, you know, we might be doing it every 8 hours scheduled, but if you need it in the meantime, just let us know, and we can also do suctioning again if you have a lot of secretions or you're feeling pretty yucky. And then with your trach dressing, unless it just gets heavily soiled, we will just leave that one on and probably just change it once a day. Do you have any questions for me or anything like that? No? Okay. If there's anything at all I can get for you, just let me know. Use your call light. Otherwise, I will be back in just a little bit to bring you your morning medicine. Thank you.